Tell me why lately I've been diagnosing a lot of kids, especially from 15 to like 21, with syphilis. And syphilis is a kind of an STI. And also diagnosing them with HIV. No, they are not born with it. They are only finding out now when they're 15, when they're 20, that now they have HIV. And when you ask them, how do you think you got this? Sister, I have multiple girlfriends who are within your age. If I'm talking to a 16-year-old who also came maybe for circumcision, because that's what I do. I do HIV and AIDS prevention. Everything that is under that umbrella, I do it, right? As a clinician. So maybe they came for circumcision. And obviously when you do circumcision, you have to test for HIV first, because you can't cut without knowing the CD4 count of the patient and also the viral load. Sometimes you check and you find out on the spot that they're actually living with HIV and they didn't know. And then you ask them, how's your lifestyle? What are your sexual habits? No, I can be sexy with condoms and I have sex with multiple girls.
Guys, South Africa alone has estimated 8.15 million people living with HIV. I don't even know one person in my circle that is HIV positive because nobody has said it. This is scary, Bafetu. This is
not 80,000, not 800,000. 8 million people living with HIV in South Africa. Then you'll hear somebody say, boy, tonight I'm not wearing a rubber, boy. Which in other words means, boy, you see, high rates of HIV and a promiscuous / cheating culture don't go hand in hand. They don't mix well. And I made a video maybe 2 days ago, the other day, in which I said that South Africa has normalized cheating. We have a cheating culture in South Africa. That doesn't mix well with high rates of HIV. And you know, usually I'm all for unprotected sex if it's within the confinements of a relationship where it's you and your partner engaging in unprotected sex. But I think now with the rise of promiscuous and cheating culture in this country, that might not even be safe anymore, because your partner might be cheating on you, sleeping with somebody else, having unprotected sex with them, gets sick from them, and then comes and lays up in bed with you, and you guys have unprotected sex. So dare I say that it's not even safe to have unprotected sex in a relationship, damn near almost even in a marriage. Please be safe, guys, and protect yourselves. Plus, it's December now. I already know you guys are going to go crazy. Protect yourselves, bro. You do not want to be on ARVs for the rest of your life, gang. Trust me, you don't. You don't. It's preventable. Just do the right thing. Do the right thing.
For grown adults to be sitting on a podcast and making jokes about HIV and AIDS and the rates and transmission and all of that is really embarrassing. It's not cute. It's not funny. Nothing that was said with regards to HIV and AIDS was funny. Saying things like spread the positivity, not funny. If I get it, everybody's gonna get it, not funny. Saying things like DNA, what? No DNA, just RSA. Let me tell you why women have more AIDS than men. There's nothing funny about it. Because also you've just showed that you don't know the difference between HIV and AIDS. And you are sitting there misinforming people, talking about they're not going to have anything to worry about anymore because the cure is out. The cure has been found. Your platform is huge. And you are saying things like this. Now, out of those 8 million people who are infected with HIV in this country, how many of them do you think watch your videos, watch your podcasts, engage with your content? How many? For you to take that opportunity to make it a shits and giggles matter instead of being like raising awareness and being like, you know what, guys, use protection. You know what? Go and get yourself tested. It's good to know your status. You and your partner must know each other's status. here, go here and here and here for ARVs. You know, that could have been an opportunity. It could have been a teachable moment. It could have been an educating moment, but no, they chose to make jokes about it. Adults on a huge platform.
The youth of South Africa. I read somewhere, girls of ages ages between 15 and 24, 850 of them get infected by HIV per week in South Africa. Let me just be dramatic with the numbers and round it off dramatically. 1,000 girls between the ages of 15 and 24 get infected by HIV in South Africa. Like, and we can't really blame it on the fucking government, because government Yarona has done a lot of sex education. They've done a lot of educating when it comes to this thing, sex. I want to understand, because this is worrying, guys. This is worrying. So in a month, 4,000 young girls get infected with HIV. We need to have this conversation. And keep on by infect banaba. Cause really, guys, like, no, while it's a krokomeli, is it blesser culture? What is it? Because to me it's concern.
You think because you've been circumcised you don't have to wear protection. Absolutely false. While it may reduce your risk of contracting HIV, you still could contract HIV and other STIs during unprotected sex. So, you think you're going to know if your partner's contracted an STI just by looking at them? Absolutely false. Many STIs have little to no visible symptoms. Testing is the only way to know for sure. So, you think only people who have lots of sex stand a chance of contracting HIV? Anybody who is sexually active and having unsafe sex stands a chance of contracting HIV.
Strange enough, I actually understand what you mean. You know, what you're saying is actually deeper than what you think you're saying. The reason why that is because females in South Africa are the most vulnerable population, and that's why they are most prone to being infected with HIV and falling pregnant. So that's why they're also the most responsible when it comes to their health. They want to know, and so they go and do things like testing, you know, just to know about their statuses, and that's why they are living with HIV consciously, because, you know, they take those steps. They are men, and we often wonder if the statistics would change if men decided to test as well. But, you know, men don't really care about testing. Those who do, but some don't really, you know, they don't really care about testing. So
I'd also like to add, Uguti, it costs between 19 to 28,000 rands a day to keep someone in ICU. And a good number of these cases of these young people who contracted HIV do end up in ICU. And since 15% of the country can only afford medical aid, one can assume, Uguti, a good number of those cases end up in public hospitals, whereby you as a tax-paying citizen have to pay to keep this particular person alive. But yet when, as a citizen, and most likely belong to the working or the middle class South Africa, when, especially if you are my color, when you comment about these things, you're speaking from a place of privilege.
South Africa has become so dangerous for young people because of HIV and AIDS. Health Department of South Africa has reported that at least 850 young women between the age of 15 to 24 are reported each and every week to have been infected by HIV. And they're saying that this number is 4 times than that of men of the same age. So meaning to say that women are likely to be infected more than the men. So out of 10 people, you have at least 8 women who are infected by HIV. And these are women from 15 to 24. This should show you that the age of consent in South Africa is very, very, we need to check it, because 15, that means this person started sleeping around when they are 13 years old or 12. And we're not including the women that are older or the men that are older. And majority of the people who are sleeping with these young girls are men who are older. So this is the reason why we have such statistics in the country, and this needs to be addressed and this needs to be checked. Parents, please check your children. Check your children, because this is very, very dangerous. Please check your children.